this DEI Forum, it's all about you and the good work you're doing across this network. And it's all for our patients. As we build our relationships, it helps us in improving our relationships in the care we provide for our patients in the team effort.
And our first question today is going to be, how is your area creating a space of belonging?
There are several pieces to my job description, but the one I want to talk about is supplier diversity. And so if you're not familiar with what that is or what that means, it's an attempt to diversify the vendors that we work with in such a way that we work with more minority-based or minority-owned companies, women-owned companies, veteran-owned companies, disabled-owned companies. And so there's a lot of benefits to both community health network and to vendors by doing that.
As we think of belonging and inclusion, the more prepared you are, the better you can serve your patients and make them feel that they belong. For a growing segment of our U.S. populations, it's said that over 20 million individuals are considered LEP patients. At community, we are approaching 50% of our patient population if you combine all the populations I mentioned above.
The work that we do, it doesn't happen in immediate solutions. This takes a while. We're playing the long game. And so that we can get to 2025, 2026, 2027, having achieved the goals of our DEI strategic plan, which is to embed the culture. And it's already here because the great work has happened. We're celebrating today the great work that has happened within our network already.
I think in terms of creating that sense of belonging and for the theme for today, it really is meeting people at the need that they have with dignity where they are. So whether it comes whether they're coming into our hospital, they're in the emergency room, and let's say they're going back to their home and they don't have food. You know, we have systems in place to provide them something right there and then where they need.
You think you know something about your organization, but yet with every speaker I learned something I didn't know. As my mind went through that, I'm assuming that I'm not the only one who didn't know, but that could be possible too. But really what went through my head was, what are better ways in which we can communicate and educate, to understand, to share, and those shares can be, praise, they can be concerns, they can be, we need to relook or re-engineer what we're doing here or there.
What really gets me is how many people are passionately engaged and interested in not just moving us forward themselves, but gathering others to really move us forward as an organization. I am so impressed with everybody that I heard talk today, and then very impressed with the engagement of the attendees in each session, with it, whether it was giving a thumbs up here or there or giving a celebration. This was very well done, and I will be 100% supportive of us doing this again. I just think it was really, really well done. So many thanks to the team, and very, very well done.
We really had 4 main goals that we really kept a compass on, that we wanted to celebrate, educate, communicate, and inspire. And we really feel we've met these objectives today. We celebrated by recognizing DEIB work across the network. We've educated by sharing ideas and learning from each other, ways to engage DEIB in our workspaces. We've had great communication on how our DEI team is partnering with leaders and caregivers to carry out the strategic plan. And lastly, really inspired each other to imagine how to make DEIB really real in our workspaces.
Our organization will be dramatically improved if we can truly get everyone in this organization to understand and participate in what this is, because this isn't a we they. This is a we community.
We hope that you leave inspired and motivated and celebrated and feel an even greater sense of belonging here at Community Health Network.